Stroke recovery is hard work. Sometimes clinicians say things that inadvertently make stroke recovery even harder than it needs to be, especially with large strokes or massive strokes. Recently, a family from New South Wales contacted me and asked me to have a look at the brain scans of their family member. Their family member had a large stroke. They wanted to understand what is going on, why is their family member having the difficulties that they do, and what sort of recovery might be possible. So I spoke with the family at length, and I looked at the brain scans carefully, and I was able to give them information that completely changed their experience of rehabilitation. So what did I do? And how did I change their experience of rehab? In this video, I'll share with you my learning from this case so that you too can benefit from my learning. If you're a clinician, you will learn about the sort of things you might want to say to your clients. And more importantly, the sort of things you might want to avoid from saying to your clients. If you're a client or a patient, you'll be learning the sort of information you want to seek from your clinician and the sort of information you need to be aware of. There are 3 parts to this video. In the first part, I will talk about the vicious cycle that patients or clients and their families enter after having a stroke, particularly a large stroke. In the second part, I'll talk about the things that clinicians sometimes say that make their clients and families spiral further and further down that vicious cycle. In the third part, I will talk about the sort of things that clinicians can say to help their clients and families spiral up and out of that vicious cycle. I would like to start with a bit of background about the person I was asked to consult on. This person was an 80-year-old person who retired and before the stroke was healthy and physically active. They were going on daily long walks. They were cognitively active, engaged in new learning, so they were actively learning new things. They were socially engaged. They had a social group that was meeting every day. And they also were very involved with their family and their grandchildren. So they were living meaningful life and they were contributing to their community and to their family. And then they had a stroke. You can imagine the shock of the family that a person who is so healthy and so active and so important to their community and their family all of a sudden getting a stroke. So there is a shock. And people know that stroke is not a good thing, but they don't understand a lot about what's going on or what it means or what is going to happen. So that combination of a shock and lack of understanding led to fear and desperation. Family was just at their wits' end, not knowing what's going to happen, what this person is going to be able to do or not be able to do. And they felt like they're not in control at all. They felt like they were passengers in a driverless car where they have no control at where the car is going, how fast it's going, when it's going to stop. And they felt completely helpless that at the time that their loved one needs them the most, they can't help them. They were a bit too late to receive clot retrieval, which is a surgery for removal of the blood clot that caused the stroke. So they didn't receive treatment that they thought they might be able to get. They were told that the stroke is large. They were told that it's not good. And over the days, they were also told that most of the recovery occurs early. And on top of all of that, there were COVID restrictions, which means they could not see their loved one. And when they could see them, it was for a very short time, once a day, one family member. In this diagram, you can see how not receiving surgery and other treatment was very difficult for them because they didn't really understand what was going on and they felt like something important was missed. The fact that they were told that it was a large stroke and it's not good fed into their fear. And the fact that they couldn't see the person because of COVID restriction fed into the lack of control. And the fact that they were told that most of the rehabilitation occurred early fed into that sense of helplessness, not being able to help their family member get rehabilitation early. So all the things that were happening around them and things that were said to them caused them to spiral down that vicious cycle. But the problem with what was said to them is that was very general information and it was a very general prognosis. However, if you've been a clinician for long enough, you would have seen people who had large strokes that recovered well. They returned to meaningful life. They returned to enjoying their time with their family, and they enjoyed independence. Yes, there might have been some modifications required, perhaps modifications to the house, perhaps modifications to their set of mind, to their expectations, both the expectations of the person who had the stroke and expectations of the family. Nevertheless, a meaningful life. Also, if you've been a clinician long enough, you would know that rehabilitation is not a short-term thing. Yes, a lot of recovery occurs short-term in the first 3 to 6 months, but recovery continues over time. There is long-term recovery that is a function of how hard the person is willing to work, how intense the practice is. So, recovery is not just short-term. When I looked at the brain imaging of this person, I was able to tell the family that they'll be able to walk and walk up and down some stairs, perhaps going to a second floor and down a second floor where they used to live is not realistic, therefore they might need to think about changing the arrangement for discharge. But I was also able to tell them that they will be communicating with them well, they'll understand what the family says, the family will understand what the family member is saying. I was able to explain that this person will engage in their previous activities, including learning, including the social engagements, and so on. I was able to give them individual prognosis, information about what their family member will or won't be able to do, their own family member, in contrast to the general prognosis information they were given previously. The information I gave them the knowledge to address their lack of understanding, gave them hope to address the fear. They were able to look at the future with some kind of positive outlook, and they were able to advocate better to their family member because they knew what they need to work towards. So I was able to give them information that helped them spiral up and out of this vicious cycle. So let's summarize with pointers for clinicians of the do's and don'ts, and pointers for clients or family or patients about what sort of things to seek and what sort of things to be aware of. The first point is about the information you give your clients and their families. You want that information to be individual and specific, the resources to be specific. It's not unusual for me to give journal papers for family to read, information that is specific to the injury of their family member. Try to give your client and the family members individual prognosis. What will this specific person be able and won't be able to do? In contrast, what you want to avoid or what you want to be aware of is a general education, general resources, general prognosis. Most of the research we have at the moment delivers very general prognosis. And even within the literature, there is acknowledgement of the limitations of the ability to prognosticate stroke. So we know that the tools that we have at the moment to prognosticate with stroke are not good enough because they're general. And I've got a video coming up about that topic as well. Also talk about stroke recovery in terms of long-term recovery as opposed to short-term recovery, and beware of the fact that as good advocate as you are, the family will be better advocates. But you need to give them all the information they need, and look out for a video that is going to come up soon about this topic. Also, as I said before, be careful of COVID being a reason to reduce communication as opposed to increase communication. I hope you enjoyed this video. Please share it with other clinicians, with clients, patients, colleagues, anyone who you think might benefit from this video. I look forward to seeing you next time. Take care till then.